So pulse is the wave of blood through the artery as the heart contracts, which means when the heart squeezes, that's what you're feeling when you're checking that pulse. Normal pulse range for an adult is 60 to 100 beats per minute. So if they are above that, that is tachycardia, a pulse rate that's above 100. And bradycardia is a pulse rate that is below 60 beats per minute. There are some handouts on D2L that will be really helpful for you that are sites that are used to measure pulse. You'll find this information on pages 238 through 240 in your book, but also refer to the handout for some practice. You will have questions about this on your quiz. Some of the different pulse points, which can be found on page 233, would include carotid, which is at your neck, temporal, which is across the forehead, apical is at the heart, and that is measured with a stethoscope. It's at the apex of the heart. Brachial is in the bend of the arm. You're often using brachial pulse when you're checking the blood pressure. Radial is the most common site for checking a pulse, and that is at the base of the hand. So when you follow the thumb down and there's a divot there, that's where you find that radial pulse. Femoral is in the groin, popliteal is behind the knee, and pedal is on top of the foot. So we talked about how radial site is the most common site for counting the pulse. And I already explained that to find that, you're going to follow that thumb down, and it's right at the base of the hand. What I have seen some students do when they're trying to find the radial pulse is they'll stick their fingers right in the middle of the inner wrist or on the side near the pinky. That is incorrect placement for finding a radial pulse. When checking for the pulse, you want to make sure that you're observing the pulse rate. So that's the number of beats per minute. The pattern, is it regular or irregular? And the quality, is the pulse weak or is it strong? Respirations includes when you breathe in and you breathe out. One breath in, one breath out equals one respiration. Sometimes I'll have students that will check a resident's respirations and they'll come up with like 44. Now, if the resident's not in distress, then that's probably too high. So you're probably counting each breath in and out as its own individual, where you need to make sure one breath in plus one breath out equals one respiration. Also, remember what the normal range for respirations in an adult is, and that's 12 to 20. Respirations are counted after the pulse. And the reason we do this is we want to kind of trick the resident to thinking that we're still counting the pulse so that they'll breathe normally. We want to keep our fingers on the pulse site and count the respirations for 1 minute. You can also count for 30 seconds and multiply by 2. When counting respirations, observe for the respiratory rate. So that's the number of respirations in 1 minute. Pattern of respirations, are they regular or irregular? And then the quality, are they having difficulty breathing? Is their respirations noisy? Is their breathing deep or shallow? These are all things that would be important to report to the nurse. Now here are some terms that you're going to want to know that you might see on the test. Apnea is not breathing. So we know that a or an means lack of or without, and pnea refers to breathing. So apnea is not breathing. Dyspnea is difficulty breathing. Once again, dys is difficulty and pnea refers to breathing. Eupnea is normal breathing. Orthopnea. This is shortness of breath when lying down, and it's relieved by sitting up. If someone has orthopnea, it's very difficult for them to lie flat for any period of time. So we need to be aware of that when we're helping somebody by making a bed or something like that. If they can't tolerate laying flat, we need to be very quick about what we're doing. Tachypnea means rapid breathing, tachy meaning fast, pnea referring to breathing. And then the last one is Shane-Stokes. And this is an irregular pattern of breathing that has periods of apnea or not breathing, followed by rapid, shallow respirations. And this often is seen when a person is near death. So we talked a little earlier about apical pulse, and that is heard with a stethoscope. This is on the left side of the chest, just below the nipple line. We use this when they have a very difficult pulse to feel when we're trying to use the radial pulse. If it's weak or irregular, the apical pulse would be a good choice. Or if the child or infant is less than 2 years old. So there's also something that's called the apical radial pulse. And this is taken to compare the apical pulse to elsewhere in the body. The guidelines for this are in your textbook on page 236. What is normal is that the pulses should be equal. Now keep in mind, if you're checking this, the radial pulse should not be higher than the apical pulse. The apical pulse, if anything, is going to be higher than the radial. And that would be if there is a circulation issue. So an example would be if you were checking the apical pulse and it was 80, and you checked the radial pulse and you got, my note here, 68. And so you would subtract the 68 from the 80, and 12 would be your pulse deficit.